to Today in Woburn. I'm your host, Samantha Stone. And with me today, we have Mayor Scott Galvin and Representative Rich Haggerty, who are here to talk about an update of how Woburn is responding to the global health crisis and some specific questions that have come up since we last connected last week. Thank you both for joining me. Scott, I'd love to start with you today, Scott, and I appreciate you joining. I know you're in your home office, and thank you for taking the time to chat with us. One of the things that has come up in conversation quite a bit is whether residents should be wearing masks or not. And we have seen at least one other town that has mandated wearing masks to go out in public. I assume that's for people who can. I mean, I suppose there's some exceptions of people who are not able to for some reason. What's sort of your stance on that? Do you think we should be doing something like that at the local level? And is it a requirement for us to be able to start opening up more businesses than we have open right now?
Well, it's a good question about the masks and the, I always listen. We listen from the state level, and they get there from the CDC, and it's recommended that you wear a mask in public if you can't appropriately social distance. So that means if you can't keep yourself within a 6 foot distance, you should be wearing a mask out. So I think that means that, when you're in tight areas that you definitely can't keep that distance, you should have a mask on. People ask me about when you're out running or walking, and I think that for me personally, like when I run, I can't wear a mask, or when I'm walking, I can't wear a mask. I find it harder to do that. But, people have, if they feel that that's what they need to do, they certainly should. My position really is that, again, clearly, if you can't do the appropriate social distancing, you should definitely have a mask on. But, there are situations where you're outside, whether you're doing yard work, or you're by yourself, or you're going for a walk. Those are personal decisions for people to make, and whatever they're comfortable doing, I certainly advise them to do. But from my position, that if you can't social distance, you should definitely wear a mask.
Thank you. I think that's good advice. And I think sometimes, anytime we're in a enclosed environment, like in grocery stores or other buildings where people are really trying to do their best, if there's things we can do to even just make the staff who have to be there more comfortable, I'm certainly, as an individual, willing to do that, to give them some level of comfort. And you raise a good point that, there's a difference between transient movement, like taking a run or taking a walk, or being in an area where you're contained. So thank you for sharing that with us.
Yeah.
In general, how are, bed availability in the local hospitals looking? Anything that we should be conscious or aware of there?
And I think Rich will follow up with me. We have a very good relationship. Both of us, a working relationship with, Rick Weiner over at Winchester Hospital. That's the Winchester, the Beth Israel group. That there's about a hospital. There's about 10 of them, and we get daily updates of regarding the beds in their hospitals, and there, it is encouraging that the levels have not reached crisis mode. In fact, I think they're manageable at this point. And from what we're seeing in the beds anyway, at Leahy and Winchester and some of the others, they seem manageable at this point.
Great, that is good news. Thank you. Rich, I've got a couple questions specifically for you. One of the things that we've been reading a lot about the last couple of days is that some of the money that was designated in the CARES Act has run out. There were lots of businesses who applied, who either never heard back or didn't get it in on time. What's next for supporting those small businesses who weren't able to benefit from that allocation?
It's a great question. So I think that the feds are set to enact an additional appropriation to be able to supplement the original CARES Act. So the folks who want to access the Paycheck Protection Program and the EIDL, the Economic Injury Disaster Loan, will be able to do so. I think they're talking around $300 million for the Paycheck Protection Program, another $300 billion for the Paycheck Protection Program, $50 billion for the EIDL. Talking another $75 billion, I think, for the hospitals across the country. All of those, of course, are incredibly important. I think they're also talking about an additional appropriation for testing. But the Paycheck Protection Program, I can tell you, I know of a local bank here who pushed out about $150 million in Paycheck Protection Program grants/loans, as long as they play by the rules, and as long as they keep all of their employees on the books, then they're able to, of course, have that forgiven. So it's really a federal grant. But they issued about $150 million, and they had another $100 million in the queue. So there is a substantial demand out there in our community and across the Commonwealth for folks who really need this help. And what we're talking about is keeping people employed and keeping people to be able to pay their mortgages, pay their rent, pay their car bills, provide for their families, all those important things. So my hope is that the feds will take it up tomorrow. I think the Senate's in session tomorrow at 4 o'clock and get this done as quickly as possible. So the SBA has the ability to get this additional $300 billion in the hands of the people who need it.
Excellent. Thank you for that. There's also been a fair amount of coverage of what I wouldn't say necessarily abuse of the system, but it looks like abuse. Some larger corporations who didn't technically break any laws, but perhaps were not the people who were intended to have the most need, who secured some multi-million-dollar loans. Have we seen any of that here in Massachusetts that we need to be watchful for?
I'm not aware of it, but I would say that I know there's been some instances that I've read about. Ruth's Chris Steakhouse jumps out. I know Shake Shack gave back their money. I think that they are coming to the Woburn Mall, so it's good to see that Shake Shack gave back that $10 million grant. At the end of the day, this program, I don't think the original intent of it was to give these types of grants to folks who are publicly traded companies who have an ability to work other market mechanisms to provide for debt relief. At the end of the day, this program was designed to help smaller companies. And I spoke with not Congressman, but Senator Markey's office on Fridays, and specifically talked about the fact that they should be thinking about ways to lower the numbers of employee thresholds so that these dollars are directed more at smaller, medium-sized businesses. I think that the number was 75% of the loans that were given last time around were less than $150,000 in the Paycheck Protection Program. So that was a good number. But there's always going to be, anytime you have a program of this size, you're going to see some difficulty in executing the plan and perhaps some bad actors. But it doesn't mean we shouldn't hold them to account and make sure that we're making adjustments as we go along so that the right folks are getting the help they need.
Good. Thank you for that update, and we'll follow up, I'm sure, to find out sort of the outcome of those federal discussions. But it sounds like we have cause to be optimistic there. There's also a lot of discussion about what it will take to reopen the economy and to have more businesses reopen. And I am not expecting, nor do I want you to take a guess about when that would be, but I think it would be helpful for us to understand at the state level, what are some of the criteria that are being discussed that would be required before we feel comfortable as a state in opening up some additional businesses?
Sure. I think everybody's trying to figure that out now. I don't think there's an easy answer to it, to be candid. Obviously we want to see more testing, but, we've seen, Great Britain as an example, the difficulty of, some of the failings of testing that's gone on over there. We want to make sure that the tests that we're going to push out there and we're going to pay for, and that we're going to build a system to actually get those testings complete, that there's actually good data coming out of it. You're going to want to get some good data in our hands to figure out whether or not folks are in any way immune. Right now, the blood tests, the rapid tests that are out there right now, most folks agree that there's no proof to immunity, even if there's antibodies present, and even if there's substantial antibodies present, that the actual individual would be considered immune. And unless somebody's immune, we really can't say with confidence whether or not they should be out in public. So that's where the concern I think is being raised right now. But there's no doubt we need to be thinking about trying to get long term getting back to normal here. It's just going to take some time. And people need to be patient and understand that our first priority has been and will continue to be public safety and making sure that we're not spreading the virus. I think there's a lot of great companies in Massachusetts and across the country that are creating rapid test systems. They're being pushed through the FDA and through the CDC, as the mayor alluded to. And right now, I think the FDA is just getting a bunch of tests out there. There hasn't been a lot of governmental review of those tests at this time, but I think we're going to see that over the course of the coming weeks. And once that takes place, And once we actually are able to have some tests in place that we can trust and rely upon, then you're going to see a greater expanse of testing that across the state and across the country.
Yeah, thank you. I think the other component of this, I assume, will be good extra hygiene practices in some businesses
Sure.
that maybe outside food handling that maybe didn't have to think about some of those things before, and making sure that those businesses have the supplies of disinfectants and things that they're going to need. Is there any discussion at the state level of preparing an inventory of those things to help businesses have some purchasing power and some centralized ability to get access to some of that
I think
required?
it's a great point. I mean, I haven't heard that, but I think it's a great point. Making sure that folks are prepared to be able to reopen their doors is important, and certainly, as you outlined, making sure that from a public health standpoint of view, that people are clean and their facilities are clean is important. And I think that there's certain businesses that will be able to transition easier, right? Movie theaters are going to be a little more difficult than maybe a restaurant that can handle folks coming in and out more easily. So each industry is going to be a little bit different depending upon the situation, I think.
Okay, thank you. And I do think that's important. We should all be thinking about that, whether, we have small businesses of all different kinds, thinking about how we would be able to implement some additional hygiene measures so we can feel comfortable and our customers can feel comfortable coming back in. Scott, I have a question for you, although Rich might want to jump in afterwards. There's a company locally here in Woburn, Arc Point, I believe is their name. I might have it incorrect. It's a lab, and they are offering paid antibody testing. And to Rich's point, I think there are some questions about the validity of tests in general, not specifically about this company, but in general. Have you had any discussions with them in terms of planning about verifying that they're the tests that are meaningful, and B, figuring out ways to make sure that our residents are able to take advantage of it should it be a useful diagnostic mechanism?
We heard about this company maybe about a week and a half ago, and right now there's been no contact from my office with them, other than, at this point, we're waiting for direction from the state, and also, from the CDC about who's offering the test and the validity of it. I'm not calling into question at all the validity of this company. I just haven't heard enough about them to recommend anybody go to them. And what at this point, what the benefit would be. I know they're doing small tests in different communities. They did one in Chelsea recently, but again, with this company, I don't know enough about them to say, one way or another, other than they're not endorsed by the city, and certainly not by the state at this point, anyway.
Great, thank you very much. So, I think a good word of wisdom on all of this throughout everything we've talked about is to make sure that people are doing their homework and having questions, and sometimes tests even that are maybe not fully accurate can provide some comfort for people. We just should always go into all of these things with knowing as much information as we can. We've had some good conversations. A reminder here today that when we are in transition and movement, the requirements around social distancing are one thing, but if we're going to be in a closed environment, whether it's hanging out in a driveway with some friends or going into a grocery store or things when there's not movement, we should, for those who can, wear masks and face protection was the advice that we were given there as much as we can. It's not mandated, but if we have that available, I've seen lots of organizations across Woburn who are offering to make face masks for those who don't have access to the medical ones and to the ones that we are saving for our healthcare providers, but also seen some very creative multi-layering of fabrics and things that provide a level of protection that the CDC is telling us is better than, not just better than nothing, but is actually offers some level of restriction and spreading things that you might have. I thank you both for joining us very much. Rich, to you first, is there anything else you'd like to add today?
Yeah, so real quick, you just want to touch base on the unemployment insurance component that was released today by the state. So I know for a while there was a bit of lag between W-2 workers and independent contractors applying for unemployment insurance. W-2 workers have been able to do that, of course, as normal, but if you're an independent contractor, as of today, a gig worker, you're able to apply through the state's website. So that's a real positive, so that folks can make sure that if you are an independent contractor, if you're unemployed, you're not working, you're able to now apply for unemployment benefits, and you should be able to do that through the state's website. It's a little bit ahead of schedule. There was some, or at least ahead of schedule from where they thought it was going to be just a week ago. But it's good news for a lot of independent folks out there who need this assistance during these challenging times. So that was some good news to share today.
That's excellent news for a lot of people. Thank you for sharing that. I think that there will be a lot of people who will be happy to hear that, and hopefully we'll be able to take advantage of that. Scott, anything else that you'd like to add?
Yeah, just two quick things. As we're in the middle of the expected surge and we're starting to see more numbers, higher numbers in the city. And I do want to take a couple minutes to thank really just to recognize the Board of Health and the work that they're doing, tracking these new cases, doing the outreach. And one of the things that I was listening to one of the local news stations, and they were talking about their nurses were just getting on board. And I just wanted to really give a good shout out to the Woburn school nurses who have been with us since day one. We've got about a half dozen of them working hand in hand with the Board of Health, and they're doing the tracing work, contacting the people who have come down with COVID, their contacts. So they're doing a great job, and they've been doing it, for the past 4 weeks. And I just wanted to make sure we recognize them. And secondly, what we're seeing in other cities and towns, we're seeing here in Woburn as well. And that's with the outbreaks in the nursing homes. And, the program that comes down from the state from Governor Baker and Polito, where they do the mobile testing, I put out a strong advisory to our assisted living and nursing home. And 3 of them have taken advantage already, and we're waiting for the others to sign up. But they were out testing today and Saturday at some of the facilities. So that's really good proactive approach to this, because those, once it takes hold in one of those small confined areas, it really takes off. So it's been well received, and the responsibility of our local assisted living and the nursing homes have been great. So I want to thank them and thank the governor as well for his leadership on that initiative.
Thank you so much for bringing that up. I had no idea our school nurses were helping in that way, but I love to hear that.
Yeah.
And I'm glad that we're recognizing them along with the other, members of the Board of Health and the important work that they're doing. So
They certainly are.
thank
Yep.
you. Yeah, I'm so glad you brought that up. And I also want to, I think the recognition from the nursing homes, look, there's a lot of people I've seen who want to do things and help. And they recognize that there's a lot of, lonely folks who are in these nursing homes that aren't able to have visitors. And I've heard a lot of very good intentions about, mailing things. And we don't want packages arriving at the nursing homes right now. We don't want to introduce anything
Right.
to those. But you can make signs, you can do, window visits. There's things that we can do. There's a great phone pal program that I believe some of the community is putting together. So I think there's lots of ways for us to help, and let's help these nursing homes and assisted living facilities protect and take care of probably some of our most vulnerable community members and neighbors.
Yeah, that's right.
Thank you, Woburn, for listening. We hope this information has been helpful. There's been some tremendous progress in terms of unemployment, and some folks who are now able to access that who couldn't before. There's still work to do in terms of extending some of the funding through the CARES Act and things. That work is ongoing. We will get updates through Rich and others as that progresses, and a good, healthy reminder to take care of each other, to continue to communicate, and to continue to know that the work that we're doing, the hard work that we're doing, staying home, is helping. It's keeping our hospitals able to keep up right now, and right now they're in a position where they're able to. So thank you all.